So we understand why glucose is dangerous for us and how the body tries to get it out of our bloodstream quickly. We see that storing glucose makes us fat, and what should happen is that leptin should kick in and we should stop eating. So why do humans get fat rather than feeling full like the animals? Some of it has to do with what we've been taught over the last 50 years, that you have to eat your regular meals to keep your blood glucose stable. And in fact, that's absolute rubbish. And as we can see from the insulin level, we want the glucose low all the time. Some of it had to do with the types of foods that we eat, because we've removed all of the foods from our diet that make us feel full and replaced them with the foods that don't make us feel full, such as fructose and glucose. And sugar is a highly addictive substance. So some of it has to do with the fact that we just feel good when we eat sugar. You get a mental reward for doing so. So has anybody here heard of insulin resistance? Great. So what does it mean? It's a bit like walking into a room where there's a bad smell. If you stay in the room after a while, you kind of get used to it. You down-regulate your smell sense. So despite the fact that the smell is the same, you don't smell it anymore. So how does it need to bother you? The smell has to get worse to bother you again. And that's kind of what happens with insulin resistance. So exposure to glucose over many years causes insulin resistance. So more insulin is required to open the same number of GLUT4 transporters to get the glucose into the cell. The pancreas senses that there's still glucose in the blood and it produces more insulin. Now, the unfortunate thing about this is that the insulin resistance develops less in the fat cells than what it does in the muscle and liver. So what that means, we're pumping more insulin and more of it's getting driven into the fat than the liver and muscle cell. So visually representing this, we see that the muscle and liver no longer respond particularly well, but the fat cells do. So you get blockage here because you need more insulin, but you're not getting more insulin, and yet this one stays sensitive, so as the insulin increases, the fat cell gets bigger. And this explains why, despite the same pattern of eating, the same level of exercise, people put on maybe 1.5, 2 kilos a year, which per day is not very much, maybe 10 grams or 20 grams or something. And then over a 25-year period, you go from looking like this to looking like this without having changed anything. So eventually the pancreas is required to pump so much insulin that it burns out. And remember, I said to you that the pancreas isn't insulin sensitive, so it gets affected by the AGEs that we were talking about at the beginning. So it gets bound by the glucose and damages the pancreas protein. This is a process that creeps up on us. So how can we tell if we're developing insulin resistance? Because this can happen to people of normal weight as well as obese people. But we know that it correlates well with abdominal girth, so the bigger your abdomen is, the more likely you are to have insulin resistance. So what do? We give people a known load, 75 grams of glucose, and at 3 points, at time 0, 1 hour and 2 hours, we measure their glucose level. And that's a standard pregnancy test. But what you need to also do is see what their insulin response is. Now, this is a test that's done at our clinic, which very few doctors order, number one, and even fewer know how to interpret properly. So we're thinking 75 grams, that's a really big load of glucose to give someone. Well, is it really? It's only the same as maybe a bowl of cornflakes, 3 or 4 slices of bread, or an up and go. So if your glucose tolerance test shows that you've got high insulin or high glucose, and you're eating a standard Australian diet, your glucose and insulin are high all the time, every day of your life. And we know what that's going to do to you. So here's a healthy patient. We'll go through these numbers over here. This person has a blood glucose level of 4.4, an insulin level of 10, and they're pretty normal. So we can see over here, this is early on in the person's life. They're pretty young and healthy. Their insulin and blood glucose levels are pretty much the same. So we're going to focus on the 2-hour scores at the moment. We look at the 1-hour score, but I'm not going to go into that with you right now. So we go a little bit down the track now. This person's now 10 years down the track. Their blood glucose is 5.6, still satisfies for normal criteria. They do not have an impaired glucose tolerance test. But look what happens to this person's insulin. Their insulin has skyrocketed up to here. Now, we're not going to know about this if we just do the glucose test, because the glucose test is normal. So we're going to assume that everything's okay. And this is what unfortunately, is being done for us right now by most places. Now, it's not surprising, though, that this person is going to be gaining weight, is it? Because what does insulin do? Drives fat into the cells with everything they're eating. So, same food intake, same blood glucose level, getting fatter because of their insulin resistance. Now, this is when it actually gets diagnosed in most people. Impaired glucose tolerance, follow-up is recommended. This person's blood glucose level is 8.3. That's a diagnostic thing for diabetes. Look at their insulin. Insulin also high. So now their blood sugar's gone up, but it's too late now. Their pancreas is already damaged by the glucose, and you've got all your AGEs and your blood insulin level is very high. So this is a problem. And what's worse, a period of time later, what happens is your glucose keeps going up, 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 up. Why? Because now your pancreas is burned out and it can't produce enough insulin to keep the blood glucose low. And the thing with this is that you need, this person's blood glucose has gone up, but if you don't know what you're doing and you look at the insulin being low, you can misinterpret this as saying, okay, this person doesn't actually have insulin resistance. Now, the standard medical response to this is to give the person insulin. That's what happens to type 2 diabetics when they get out of control. They get insulin. But it doesn't make sense to do that, does it? Because the problem isn't a lack of insulin, it's the body's response to it. So all you're doing is pumping more and more and more insulin. You need to change what caused the problem, which was the carbohydrate, not the insulin. And that's a very important point. So, the good news, if you take the carbohydrates out of the person's diet, they get less insulin secretion, and this is partially reversible. Over a long time, it's actually really well reversible. Now, these are patients actually from our clinic. You can see that the person's insulin started off at 578, March, June, 7 kilograms of weight loss. Not a huge weight loss, mind you, but their insulin level has halved. Same thing. This person's 70, nowhere near as bad as that person, but still very abnormal, back down to 38, and 114 down to 71 with weight loss over here. So the amount of weight that you lose doesn't necessarily direct how much insulin resistance you'll reverse. And just remember, insulin resistance underpins type 2 diabetes. So what else can happen? You can reduce your HbA1c. So this person's over 6 months, and this person's over 3 months. This person was obviously much higher than this one. This one's still out of normal range, but way better and trending downwards, whereas this person's gone from being outside the normal range to being inside the normal range. Massive reduction in their glycation risk.